February is Heart Health Month, and most adults keep a close eye on their hearts, but what about children?
Joining us this morning from Gunderson Health System to talk about monitoring your child's heart is Andrea Winters. Good morning, Andrea.
Good morning. Thank you for having me.
Thank you for joining us. So how common are heart issues in children?
Fortunately, vast majority of kids have very healthy hearts, and our job is to help give them the tools and model behavior to help keep it that way for their lifetime. Of course, there are a few kids out there that may have undiagnosed and even potentially dangerous heart conditions, and so it's important to be aware of what symptoms to look for and the importance of well-child visits and pre-participation exams that can help find those clues that might open that door for us.
And what are some of those signs and symptoms that a parent might need to look out for in their child?
Yeah, again, rare thankfully, but exercise-provoked symptoms can be a big one. So kids who are struggling with new chest discomfort during exercise, getting more short of breath than they had, or having a harder time catching their breath after, but fainting too. A lot of kids do faint, and fortunately most of the time it's not heart-related, but any fainting during or right after exercise should be evaluated. Of all those symptoms, still in the end, a lot of them may not be a heart-related condition, but those are the kids that definitely need further evaluation and may need more in-depth testing.
And this isn't something that just plays a role with kids because all of us deal with stress. So how does that factor into our heart?
Yeah, stress can impact kids and their heart health in a couple ways. First of all, kids who have a lot of stress might be struggling with anxiety or depression or even trauma in their life. It makes them harder to follow through with healthy lifestyle. We want to set those lifestyle healthy eating patterns and staying active everyday patterns when they're kids, because we know then it's more sustainable throughout their life. When they have stress or anxiety or trauma, it's harder to be able to do those things. They may not have the same access to those things. It might be harder to participate in extracurricular activity or learn about nutrition or make healthy choices. But they're also more vulnerable to some of the risk factors that impact our future heart health. So things like high cholesterol and high blood pressure and high blood sugar, it does impact children. And the younger they are, if they have that, and especially if it goes undiagnosed, it can have a big impact in the years to come. So I think it's important for kids to come in for their wellness exams or address stress or mental health concerns, but also be screened for those silent threats to the heart, like having labs drawn to check cholesterol, which is never popular, not really fun, even for adults, but can be really important for us to recognize in kids.
Well, Andrea, some very important points there, and we really appreciate your time this morning, and thank you for joining us.
Thank you for having me. Have a good day.